Hundreds of residents of the indigenous communities of Orealla and Siparuta on Thursday and Friday benefited from a medical outreach led by Director General of the Ministry of Health, Dr. Vishwa Mahadio, and comprising 13 medical personnel.
It is the mandate of His Excellency President Tirfanali that we take healthcare to the people. He spoke about equal and equitable access to healthcare, and we know that persons in these areas, it's more difficult. The highest level of care in this area is a health center. Of course, we have a doctor who's based here.
The team included dental surgeons, optometrists, dermatologists, general practitioners, and an ultrasound technician who is part of a Cuban medical brigade. VIA screening was also done for women. The dental team conducted more than 250 dental procedures on more than 150 persons.
Procedures that include things that were never done before in these communities, things like the root canal and doing other interventions that were never before done here. The head of the Chedijagan Dental Center himself is here, Dr. Sullivan, and he has been leading this team. So we had literally 3 chairs working at the same time, and this is why we could have achieved this much in the 2 days.
Almost 50 ultrasounds were done on persons, including the elderly and pregnant mothers in the community, while 55 persons saw the dermatologist.
And in all the cases, like in the case of optometry, we are looking at making a list of those cases that would need intervention. So we are talking about the pterygiums, we are talking about the cataracts, we are talking about the glaucomas that might need surgical intervention or other interventions. And this list we'll be working on. We are hopefully going to be able to take these persons out to get it done, if it cannot be done here.
Dermatologist Dr. Latoya Dayal noted that most of the skin conditions she saw in patients were children affected by the hand, foot, and mouth disease, eczema, and fungal infections.
The hand, foot, and mouth disease is an infectious disease. So I was advising the nurses and so on to speak to the community leaders to encourage hand washing among the smaller children to prevent the spread of this disease. As for the fungal infections, those are due to sweating, and in this community the sun is very hot and the persons do a lot of farming, which causes them to sweat. So even though I was able to give medication, the advice would have been to avoid getting too sweaty and avoid having the skin too damp.
Some of the persons who accessed the medical services were grateful for the opportunity. Here's what some of them had to say.
I'm really glad that the doctor come to Siparuta and to do this VIH, and I'm so glad because there's so much money for go out, go do it.
Well, I'm very thankful for our present president, what he has promised us that he's doing here today. I'm very thankful for the team, Dr. Mahadio and team. They always promise to do their best for the people everywhere in this country. So I'm really thankful for this team.
I really feel happy about this because in our community, there are a lot of women. The first thing when we notice that they are having this sickness, right? So they're bad, and some of them, are die with it. So I'm so happy today, and I'm proud that this doctor come and he could do this test for us. And I also do it because I'm happy to make sure that our body is safe and perfect health.
For a very long time, we didn't get outreach like this. And it's very important for our people in our village because many times we have to travel out to go to New Amsterdam to get treatment for all type of thing like eyes, whatever, and sometimes we don't have even money. And emergency cases, it's really difficult, right? But we thank God so much that the team is here.
We don't really often get the boat to go out, or if we travel with the boat, we have to take a day or a night to reach out. And we go into the Skellen Hospital, then we get transferred to the New Amsterdam Hospital. It's very difficult for us. For us to go there, then we have to come back and go back, and I want to say thank you so much.
There are a lot of us that are sick And it is difficult at times for us to go out there, like in New Amsterdam or in Curryfordton. And it's all because of the transportation also. Because right now we don't have like transportation to take us out, especially when we are sick. Unless it is emergency, then we go out with the ambulance. So I'm very happy for this outreach here.
This was one of his promise, outreaches like these. And I'm happy that this is happening now in Orealla. And he has stand to his word. And I am asking that this must not be the only outreach. It must be something routine.
The outreach actually come at a critical time that we need this health care service the most because due to the COVID situation, most of the residents here don't have the opportunity to go out that often, especially to deal with only one issue. Unless they have other business to take care of, they will make one trip out on the coast to do everything all together. So it's very nice that the Ministry of Health can have a team to come up here in Orealla to provide all these services.
Also part of the visiting medical team was head of the Cuban Medical Brigade, Dr. Ruiz Arcia Inaldo, who expressed his gratitude for being able to provide specialized care to the Guyanese population.
The Ministry of Health has requested the Cuban Dr. Inaldo, who is the head of the Cuban Medical Brigade, in order to place Cubans in all these hinterlands places, and we are evaluating the possibility in a new batch of Cuban doctors to come to bring some doctors here.
Dr. Mahadio also visited bedridden and elderly people in the communities to ensure they too benefit from the medical outreach.
Reporting from Orealla in Region 6, I'm Natasha Smith-Thomas.